Discuss about the autoimmune disorder which is called as celiac sprue or celiac disease. The celiac disease is otherwise called as non-tropical sprue, and it is also called as gluten sensitive enteropathy. And this celiac disease can occur in any age group, and this disease is called as iceberg phenomenon because 50% of the patient usually go undiagnosed. And the main thing is that when gluten restriction diet in these patients often bring the symptoms makes the patient normal in next 6 months. If gluten restriction diet is continued for about 6 months, we can bring back the patient to normal. If the gluten restriction diet does not bring back the patient to normal in 6 months, we call it as a refractory celiac disease. And let's see what are the clinical features will be seen in the case of celiac disease. And the most common clinical features are the short stature, failure to thrive, bone pain, osteopenia will be seen, and even iron deficiency anemia will be seen, and other classical features like osmotic diarrhea, abdominal distension, weight loss, any foul smelling stools, and all these will be seen in case. So all these are the clinical features which are seen in case of celiac sprue or celiac disease. And the autoantibodies which are implicated in this celiac disease are the anti-TTJ antibodies, anti-endomysial antibodies, anti-deaminated glutamic dipeptide, and also HLA association like HLA DQ and other will be seen. And let's look further investigations which help for the diagnosis of celiac disease. And the investigations which help is nothing but the serology and even the biopsy. And what we look for the biopsy is that villus atrophy and cryptohyperplasia will be seen. And what this indicates is that overall will be normal, but mainly the villus atrophy as a result of which absorption is being impaired. So villus atrophy and also crypt cell hyperplasia, serology, and all these histology features and serology, and both will help us for the diagnosis. And we say that this celiac disease is a pre-malignant condition, and the malignancies which are implicated in this are the small intestine adenopathy, small intestine adenocarcinoma, esophageal small cell squamous cell carcinoma, or enteropathy associated T cell lymphoma, and all these are cancers which are implicated in the case of celiac disease. And what is the mainstay of treatment in this condition is that Bro has to be restricted. What is this Bro? B is for barley, R is for rye, O is for oats, W is for wheat. So this Bro restriction, these contains a gluten, and the main antigen which is implicated in the celiac disease is the gliadin antigen. Gliadin is the main antigen which is implicated, and the restriction of gluten itself is the treatment for these patients, and we call it as a celiac disease. And thank you for watching.